Did Trump have a stroke? Why did his face suddenly droop on camera? And what does that have to do with the signals your own body may be trying to send? The images of Trump suspected of having a stroke raised urgent questions, and behind those questions lies a critical truth. Stroke and heart attack are two of the leading causes of death in the United States. Every 40 seconds, someone has a stroke, and every 34 seconds, someone suffers a heart attack. These numbers are not just statistics. They are reminders that anyone, even a former president, can become a victim. The issue is not about fame or power, but whether you recognize the warning signs before it is too late. When Trump was suspected of a stroke because of facial drooping, millions of Americans asked themselves, if this can happen to him, am I ignoring dangerous warning signs in my own body? Unusual cold sweats, unexplained fatigue, shortness of breath with light activity, or a face that suddenly droops, these may all be whispers from the body. But too often they are dismissed as normal aging. In this video, you will get a clearer answer to the question of whether Trump had a stroke. You will understand why a single change in his face was enough to raise concern. Most importantly, you will learn how to recognize the early signs of stroke and heart attack, understand the real causes, and know when it is time to act immediately. This is not just information. This is knowledge that can save lives. Do not underestimate it. A quick decision, one timely phone call, can mean the difference between returning home to your family or never seeing them again. Before we go deeper, I encourage you to take a moment to click subscribe and turn on the notification bell. That way, you will always receive important updates on heart health and on how to recognize the early warning signs of stroke and heart attack. This knowledge is not only for you, it can also protect your family, your friends, and the people you love. One small action today can make a very big difference tomorrow. As the question of whether Trump had a stroke spread across the news, many people began confusing stroke and heart attack. In reality, these are two completely different conditions, and knowing the difference can determine survival. A heart attack, or myocardial infarction, happens when oxygen-rich blood flow to the heart is blocked by plaque or a blood clot. When the flow is cut off, the heart muscle is starved of oxygen and begins to die with each passing minute. Typical symptoms include severe chest pain, shortness of breath, cold sweats, fatigue, and pain radiating to the left arm, back, or jaw. This is a medical emergency doctors describe with the phrase, "time is muscle," meaning every minute lost destroys more of the heart.
A stroke, on the other hand, affects the brain. It occurs when a blood vessel in the brain becomes blocked or ruptures, cutting off oxygen supply to brain cells. The result can be facial drooping, weakness or numbness in the arm, and slurred or difficult speech. This is why so many viewers questioned whether Trump had a stroke and why facial changes alone raised such concern in the video. For the brain, experts use the phrase "time is brain" because every minute of delay costs millions of irreplaceable neurons. The common ground is that both the heart and the brain cannot survive without blood flow for long. The difference is that a heart attack destroys the heart, while a stroke destroys the brain. Recognizing the signs correctly allows you to take the right action, call for emergency help immediately, and increase the chance of survival. So, what truly causes both the heart and the brain to be attacked? What is behind these dangerous events, and why have they become the greatest threat to people over 60? When the images of Trump suspected of having a stroke spread, many people began asking not only about his health, but also about their own. The question of whether Trump had a stroke is a reminder that serious medical events rarely come out of nowhere. They often build silently over years. The root cause of both heart attack and stroke is the same: a blocked or ruptured blood vessel. In a heart attack, the affected vessels are the coronary arteries, the pipes that supply blood to the heart muscle. Over time, cholesterol, fat, and calcium accumulate along the vessel walls, forming plaque-like residue inside a water pipe. At first, the blood flow is only slightly slowed, causing no symptoms. But as plaque grows or ruptures, the body responds by sending platelets to patch the area. The resulting clot can completely block blood flow, depriving the heart of oxygen and triggering a myocardial infarction. In a stroke, the blockage happens in the brain. A clot can lodge inside a blood vessel, cutting off oxygen to nerve cells. In other cases, a weakened vessel ruptures, causing bleeding into the brain. The brain is highly sensitive to oxygen loss, and within minutes, millions of neurons can die permanently. This is why stroke has earned the name silent killer. The major risk factors fueling both heart attack and stroke include high blood pressure, diabetes, high cholesterol, obesity, smoking, inactivity, and chronic stress. In the United States, especially among those over 60, diets high in salt, sugar, and processed foods raise the danger significantly. The question of whether Trump had a stroke may not have a clear answer, but it underscores an important truth. No one is immune to risk. Whether a former president or an ordinary person, if the risk factors are present, stroke and heart attack can strike at any time. So, what warning signs appear before these crises, and how can you recognize them in time to save yourself or a loved one?
Warning signs of stroke. Stroke has long been recognized as one of the leading causes of death and disability in the United States. Statistics show that every 40 seconds someone suffers a stroke, and every 3.5 minutes someone dies from it. The most frightening part is not the numbers, but the reality that it can happen to anyone, regardless of social status or access to medical care. That is why, when the media raised the question of whether Trump had a stroke, millions of Americans were jolted into reflecting on their own health. What makes stroke such a silent killer is that the body often sends early warning signals, but most people ignore them. Understanding and recognizing these warning signs is the key to survival. Trump's suspected stroke, with his face drooping on one side, is a clear example of the danger when such signals are overlooked or dismissed. In the FAST rule, face, arms, speech, time, the letter F always comes first. FAST is a tool doctors worldwide use to help communities quickly remember and recognize the most important signs of stroke. Face, when one side of the face suddenly droops, when a smile becomes uneven, or when an eyelid sags, that is one of the most critical warnings. This is exactly what led the public to ask, did Trump have a stroke? During the 9/11 memorial event, his face appeared visibly asymmetrical. Observers immediately compared this to the first sign in FAST, and many concluded that suspicion of a stroke was reasonable. From a medical standpoint, facial drooping indicates that the part of the brain controlling facial muscles may have been deprived of blood temporarily. The next letter in FAST is A for arms. A person having a stroke may be unable to lift both arms at the same time, or one arm may feel noticeably weaker than the other. This is also a classic warning sign, though it can be harder to spot without close attention. In past appearances, Trump was seen with bruises on his hand and swelling in his leg. While there is no clear medical evidence that these were symptoms of a stroke, for those concerned about heart and brain health, such details strengthen the suspicion that he may have experienced a transient ischemic attack or another circulatory disorder. Small signs like these, when viewed through a medical lens, highlight the reality that stroke warnings can be subtle and easy to overlook.
S stands for speech. A person having a stroke often struggles to pronounce words, slurs their speech, or speaks in a confused manner. This happens because the language centers of the brain are affected by lack of blood flow. You might be having a normal conversation when suddenly the person's words make no sense, or they are unable to clearly express what they want to say. In media analysis, some observers claimed they had noticed Trump slurring his words slightly during certain public events. While this information has not been verified, it does align with what medicine has long recognized. Sudden changes in speech are a critical warning sign of stroke and should never be ignored. T stands for time. Time is everything. When any of the FAST signs appear, calling 911 immediately is the only correct response. Doctors emphasize that in ischemic stroke, clot-busting medication can save brain tissue if given within 3 to 4.5 hours of the first symptom. Every minute of delay kills millions of brain cells. This is why the phrase "time is brain" serves as a guiding principle in stroke emergencies. If Trump's suspected stroke truly reflected a transient ischemic event, whether or not he received medical attention quickly enough could be the deciding factor between full recovery and permanent disability.
Beyond FAST, there are other warning signs of stroke such as sudden vision loss in one eye, severe dizziness, loss of balance, unusually intense headaches, or numbness on one side of the body. What makes them frightening is that they can appear and then disappear within minutes. These brief episodes are known as mini-strokes or transient ischemic attacks. Even though they are short-lived, they serve as a powerful warning that a full-blown stroke may strike within days. This is also why the public grew concerned when noticing other health issues with Trump in the past. Bruises, swelling in the legs, and images suggesting medication use made many think less of coincidence and more of a pattern of medical warning signs. Whether Trump actually had a stroke may never be confirmed, but the incident itself sounded an alarm. It showed that even a former president with access to top medical care is not immune to risk. This reality is even more pressing for millions of older Americans living with high blood pressure, diabetes, high cholesterol, or sedentary lifestyles. The critical point is not to debate whether Trump truly had a stroke, but to take away the lesson. Recognize the early warning signs, do not ignore them, and do not delay. A timely 911 call can save your life or the life of someone you love. If stroke is the thief that steals memory, speech, and mobility, heart attack is the thief that takes away the very beat of life. The real question each of us must ask is not, did Trump have a stroke, but if it happens to me, will I recognize it in time to act?
When a heart attack or stroke strikes, every second can mean the difference between life and death. That is why doctors emphasize time is muscle for heart attacks and time is brain for strokes. With each passing minute, millions of cells in the heart or brain die and cannot be restored. The single most important step in an emergency is to call 911 immediately. Do not attempt to drive yourself to the hospital because your condition can worsen on the way. An ambulance not only gets you there faster, but is also equipped with medical staff and equipment to begin treatment right away if needed. For a heart attack, if the patient is conscious and not allergic, doctors often recommend chewing a low-dose aspirin while waiting for emergency care. Aspirin can help prevent new clots from forming and reduce the risk of complete blockage. However, it should only be used if it is available and if your doctor has previously advised it. For stroke, never take medication at home on your own. What you should do is keep the patient in a safe position, avoid giving food or drink, and make sure the airway stays clear. Once at the hospital, doctors will determine the type of stroke. For ischemic stroke, clot-busting drugs can be given within the first few hours to dissolve the blockage. For hemorrhagic stroke, the treatment is completely different. A life-saving principle is never to wait and see if symptoms go away. Many lives have been lost by missing the golden window. At the first sign of a possible heart attack or stroke, treat it as an emergency and act immediately. If the earlier section helped you recognize the warning signs, this part tells you how to respond in the critical first moments. But the next question is, how can you lower your risk in the first place and live healthier as you age? That is exactly what we will cover in the next section. Preventing heart attacks and strokes is not just about timely emergency care. More importantly, it comes from building a lifestyle that protects your heart and brain every single day. Health experts confirm that a healthy lifestyle can prevent more than 80% of cardiovascular disease and strokes. This means you have the power to take control of your health. A top priority is controlling blood pressure, blood sugar, and cholesterol. These are the three silent enemies that damage blood vessels over the years. Regular checkups, taking medications as prescribed, and monitoring at home are simple but critical steps. Your diet also plays a major role. Focus on vegetables, fruits, whole grains, fish, and healthy plant oils. Limit salt, sugar, fast food, and processed meats. For older Americans, lowering sodium intake to less than 1,500 milligrams per day can significantly cut the risk of stroke. Regular physical activity is another key. You do not need intense workouts. Just 30 minutes of brisk walking 5 days a week can improve heart health. Keeping your body flexible with light activities like yoga, gardening, or swimming also makes a big difference. Another important habit is quitting smoking and limiting alcohol. Quitting smoking alone can lower your risk of heart attack to nearly the same level as someone who never smoked within a few years. Finally, do not forget your mental health. Chronic stress raises blood pressure and accelerates plaque buildup. Make time for quality sleep, relaxation, and staying connected with family and friends. Prevention is a lifelong journey, but every small step you take today builds into major benefits for the future. And once you know how to prevent these conditions, the next challenge is remembering these lessons long-term and sharing them with the people you love. At this point, we have covered the most essential knowledge: the causes of heart attack and stroke, the warning signs of both conditions, the steps for emergency response, and the long-term strategies for prevention. Each part is not just information, but a reminder of the value of time, of life, and of family. The question of whether Trump had a stroke may never have a final answer, but what matters more is the truth it reveals. If a former president can appear with unusual signs, then any one of us could face the same risks. Health does not recognize status or power. It reflects how well we listen to and care for our bodies. Remember, recognizing symptoms early and acting quickly can be the line between life and death. A timely 911 call can save you or a loved one from devastating outcomes. A small change in diet or daily activity can stop tragedy before it begins. If this video has been useful, I encourage you to share it with your family and friends. And to continue standing with us in protecting heart and brain health, click subscribe and turn on the notification bell. The knowledge you gain today could save a life tomorrow. Your heart and your brain are priceless assets. Do not wait until they scream for help. Start caring for them today.